My name is Stephen Cohen. I'm the CEO and co-founder of SaRA Health. Now, I have some bad news for you. This presentation is going to involve some audience participation. We're going to start now. How many of you knew that General Motors spends more on healthcare for their employees than steel? Not that many. Then I bet this will surprise you too. 80% of U.S. employers above 500 people self-insure for their employees' health care. That's 16,000 firms and over 50 million employees. And these firms spend $300 billion every year on musculoskeletal care alone, with musculoskeletal being strains, sprains, and total knee replacements. Despite all that money, they're actually getting billed twice. Because the #1 reason for missed work days, musculoskeletal issues, with over 752 million days of lost productivity last year alone. Why is this? Because patient engagement and adherence outside of the doctor's office is absolutely abysmal. We're back to the participation. How many of you have had physical therapy before? Quite a few. Keep your hand up if you actually did all of those home exercises that your physical therapist gave you. I didn't. It's not my fault, it's not your fault, and it's not your provider's fault. It's because this is what typically is state of the art. A paper handout, but wait, there's personalization. You see those scribbles. And what is that experience like once you leave the clinic? An accurate representation, a black hole, no information going in or out. At SaRA Health, we've developed SaRA, the Simplifying Recovery Assistant that provides better patient engagement, resulting in shorter recovery times and better outcomes. Well, how? Let me play you through what it would look like for a patient and provider to use SaRA. Instead of going to the binder, physical therapist films the patient doing their exercise. So that way it's personalized to each and every patient, and they have something to go back and review. As a patient, I then report on quantitative measures, but also can record myself doing the exercise, so that way my physical therapist can be able to see exactly what's going on at home. And no more black hole. The physical therapist can quickly and easily make adjustments to my care plan with our asynchronous communication flow, so that way the program is always live and dynamic. For further, deeper questions, our HIPAA-compliant video conferencing software allows for the patient and provider to be able to talk through what's going on. An injury is an injunction on a patient's time. Therefore, we developed a proprietary text messaging system to help keep us patients on the straight and narrow. Back to the employers. We sell to self-insured employers at $30 to $50 per injured employee per week. So these employers are only paying for what they use. To put that in perspective, Kansas City, Missouri Fire Department, with their 1,100 employees, estimates that we would save them $370,000 in avoided overtime cost, giving them a 10x ROI on our contract. I didn't just pull them out of thin air. That is our target market. The 700 U.S. cities that self-insure for both healthcare and workers' compensation and own fire and police. Then, partnering with the third-party administrators and insurance brokerages that already serve the rest of the self-insured employer population before finally going after the carriers to truly take SaRA to the next level. When we started the program, we had some success, but really didn't have a solid game plan moving forward. In this 3.5 months, we have signed the city of Lenexa, a Kansas City suburb, are currently contracting with the city of Kansas City, Missouri, and their 5,000 employees, and have 6 others that we're in deep pilot discussion with to further expand our impact. We've also partnered with 3 third-party administrators. One, the 6th largest in the U.S., the other 2 owning all the major municipalities in Kansas, Missouri, Oklahoma, and Tennessee. And finally, on Friday, we began a pilot with Lockton, the 8th largest insurance brokerage in the world. We know that a technology-only approach will only get us so far. So we partnered with Revolution Human, a direct-to-patient physical therapist company, to be able to combine our technology with providers for a solution that's dropped right at the employer's doorstep. We've already piloted this with Confluence, a consulting company where we're seeing engagement at 2 to 3x the national average. The team that's pulling this off, the lead, our CTO, with a master's in computer science and previous application development experience, Ryan, who's previously done physical therapy research at UCSF, and myself. I helped develop Medtronic Diabetes' self-insured employer offering to compete against Livongo, Omada, and Noom, and have a bit of a blue-collar streak myself. That's me in front of an oil field pulling unit. My first company I started, I'm not allowed to say the name on stage, but find me out there afterwards, and I'll be happy to tell you. We're joined by clinicians, self-insured employer experts, and workers' compensation company owners. Our ask here today is for introductions to third-party administrators, insurance brokerages, and city officials to help us expand our impact. We're not actively fundraising today, but we'll be going out for a pre-seed round in the latter part of this year, and if there's anyone you think would be beneficial for us to speak with, would love to know who that would be. Patients deserve more than pills, paper handouts, and pats on the back. They deserve a way to cure themselves. They deserve SaRA. Thank you.